Okay. Okay. Hey, everybody. How are y'all? We're so excited that you're here. We have some pretty incredible information for you today. I want to introduce to you my friend and our doctor, Dr. Melanie Throne. So what I would love for her to introduce herself, share a little bit about her background and what you do.
Okay. I am incredibly honored to be here with you, especially on a week where you've already had 2 interviews. Greetings to all you warrior advocates. I'm stealing that from Dr. Temple. Earlier in the week, she greeted everybody, so I will steal that from her. But I'm a general family dentist. We clean teeth, we do fillings, crowns, things like that. But just several years ago, I took one course on airway dentistry, airway-centric dentistry, and discovered that there was more to what I was doing and what I was seeing than I had been taught. And so I have since just committed my life and my study life and the lives of my family and my staff, everyone, to trying to make a difference in a world that there's not a lot of information on and out there. Despite our efforts, it's slow moving, but it is beginning to gain some traction with tethered oral tissues and with breathing and how critical and how those play into each other. So that's kind of my story. Most of the time I'm doing general dentistry, but a good fair portion of the time now is taken up trying to help people with at varying age groups that are struggling and aren't getting any answers. So, all right.
Very good. Well, I wanted Dr. Throne to come on because we're going to get into kind of my story and how we met. And kind of what brought me to her, and it's pretty incredible. But I wanted her to share with you guys, really just all the amazing things that you're doing in your practice when it comes to, like you were saying, with the TOTS and the ADHD and all of these different things. So she has a PowerPoint that she's going to kind of walk us through and give us lots of great resources and education in regards to all of this. So I'm going to turn it over to you, girl.
Okay.
We're going to try to share our screen with you so you can see.
There we go.
Great.
All righty. So we're going to be talking about airway, tongue tie, and then some of the things that you may or may not be familiar with that are associated with that, and kind of connecting some dots for you if you're struggling with some of these issues, even if you don't realize that these issues are connected. Yes, I'm doing a play on words there since we're talking about tethers and ties. A lot of these issues are connected, and it's part of trying to navigate a world where you feel like you're stuck in sick care and not health care. So I'm going to switch my slide here and show you about some of the symptoms that we're talking about. I'm sorry if we're superimposed over the adult symptoms, but you can kind of extrapolate that. But it doesn't matter your age, you can be having some symptoms with these tetherings, and whether you're an infant struggling to breastfeed, a mom that's trying to breastfeed a child that is struggling with this and you're having pain, or the baby is having symptoms, or both, or a child that is having speech issues, isn't sleeping well, is hyperactive, or is looking at an ADHD type of a diagnosis. We deal with that group as well, all the way up to adults that are suffering and have been suffering once they learn about all of this. Many of the adults that I see, once they learn and realize and know about all these comorbidities. They think about their lifespan and realize that a lot of what they've been suffering with all along, back to childhood, even infancy, they realize, wow, this has been affecting me my entire life as they become knowledgeable about it. So we'll go through some of those. Let's look at this next one. So tell us a little bit, Casey, about your story with Bowen.
Yeah, so I wanted to backtrack a little bit because what's interesting is this started out long before Bowen. This was my very firstborn with Landry, and first time mom, I had no idea what a tongue tie, a lip tie, a buckle tie, I had no idea what that was whatsoever. So when Landry came along, nursing with her was extremely, extremely painful. And I had no clue why. And so about after 2 weeks of trying, I gave up and decided that I guess I'm just not meant to breastfeed, because I don't know why this is extremely painful, and she, fussy and all the things. So I pumped with her for 8.5 months. Later had found out that she was in fact tongue tied and lip tied. And we had found out after years of marriage that my husband was actually tongue tied as a child, and they did not find out with him until he was close to 7 years old. And we had no idea that it was a hereditary thing. And so that was kind of the beginning of the journey of starting to really kind of looking into what it was. So our second child came along. We knew to look and see on tongue tie, but she seemed to nurse perfectly fine. However, she was extremely, extremely fussy, had what we thought extreme reflux. We did not know that was related to that at all. So we quickly jumped to medicating her with reflux medicine, and that seemed to help. And so at that point, we did nothing else because it seemed to kind of subside everything. And I nursed her for 13 months, which is so crazy that even worked out. I don't know how. But she actually, out of all three of my children, I think she's the worst out of all of them as far as her tongue and lip tie. And then enter in Bowen. So here's Bowen, his sweet little mouth. He came around, and by this point, we had really began educating ourselves. And so I had gone into the hospital knowing that was the first thing that I was going to look for, because there was a very good chance he was going to have it too. Lo and behold, he was tongue tied. And so I had asked them to clip his tongue in the hospital. They clipped it. We thought all was well, came home. And it was just from that point forward, a very dark place for us. He was extremely fussy, screaming all the time. We had no clue why, very gassy, very refluxy. When he would nurse, he had the blistering, and you'll see, we're going to show some slides on that, but his little lips were blistered because he was not getting a good latch at all, because he was so restricted. He would click every time that he would take a suck. It would be every time that he would drink. And later had found out that is them, because their tongue is so restricted, their tongue is not able to wave like it's supposed to when they are sucking. It's literally just at the tip. And so that is why it's painful. That is why, because they're sucking in all the air, which is giving them the gas, giving them the reflux. So at that point, we just began searching. We didn't know. We thought we had fixed the problem at the hospital. So I didn't even think maybe there's still an issue there, because I thought we fixed it. So we had gone to pediatrician after pediatrician to try to get gas and reflux help. We actually started him on medication and it did not help at all. The problem was still there and he still screamed for hours. So we began at that point going to chiropractic care and trying to do some body work with them. We're going to go this route. We're going to try this. While it did help and provide some relief, every time we went, our chiropractor talked about how extremely tense our son was. And, when you hold an infant, typically they're very relaxed and sleepy and all the things. Bowen was never that way. He was always a tense, tight child. And so, no matter how many times that we went, he was always so tight. And
I might just interject real quick.
Yes.
These babies that come in with this, a lot of times, just to your point, I literally can stand them up and this is at 2 days old, a week old. I can stand them up and I'm just balancing them, but they're supporting their own weight and they don't feel like a normal child. They don't have to be supported, in infancy. They should not be able to support themselves or the weight of any part of their body at all or have any control like that. And these babies will be very, very tight, very tense and not feel, that may be one of your first kind of warning signs or things that get your attention.
Yep.
When you first hold your baby, if the baby's stiff head to toe or twisted, those are all things to kind of pay attention to and look at posture wise. So
Yes.
Go ahead.
And we would do, when we held Bowen, he always looked to the same side. He was never direct on. He was always cocked to the same side all the time. When he slept, he would only turn his head to one particular side. And that was because everything, all of this being connected was so tight. That's the only way he could go. And so, we began kind of connecting the dots and we were in the chiropractor's office one day. And I truly believe the Lord gives us that mama instinct. And I just straight out asked her, like, would you please check in his mouth again? We got him clipped in the hospital, but what else is there? And she looked, and sure enough, she said, because she herself was a lactation consultant as well. And she said, yes, ma'am, he is lip tied. He is still tongue tied, even though he got clipped in the hospital, and he is buccal tied. So tied on both sides of his mouth. And so at that point, it was just like, oh my word, like this is all connected and this all is making sense. And so we were referred to Dr. Throne. We went in, got a consultation with her, and they did super quick release of everything. And I am not kidding y'all. I'm not kidding you. When she handed me him back, like I could cry right now. When she handed me him back, he was just so relaxed. I've never felt him that way ever. And so it was pretty incredible how in an instant, just being released, that poor baby was just like, oh, thank you, mom.
They almost make that noise when they're really as tense as Bowen was. They almost, while we're in surgery, let out a little gasp like that of relief. And many of them, you just see this wave come over them, whole body, and boom, they're asleep. And then they sleep through the rest of the surgery. So it gets me crying right there in the surgery to think how much they've struggled. And I know with mom, how much you struggle, and I'm so empathetic to that. And when I see that, it really, me and the whole staff there in the surgery operatory, we really, it's profound effect even on us. So.
Well, and I know as a mom, you get to this place of desperation and you just have tried everything that to try. And I feel like this particular subject, people don't know about it and they don't talk about it. Providers oftentimes don't know about it. And, you know, it's just, it's incredible how everything is connected. You know, just the way that God designed it, and when it's not working the way that he designed it to, how it can affect so many different things in the body. And so we hope that this brings you guys some encouragement, some mamas, some relief of like the light bulb going off, because I know it did for me that day. And it's just from that point forward, things completely took a big turnaround for us, in a very desperate place. You know, you're sleep deprived, you're all the things during that time. And when your baby won't nurse well, you think that it's your fault. You feel like a failure.
Or you're told it's your fault.
Yes, and or you know, often you feel like I'm crazy for, you know, thinking these things or trying to figure out these things, and people think I'm crazy. But I want to encourage you to go with that God-given mama instinct and don't give up. Do not give up. Advocate for yourself and your child. And there are plenty of people out there, just like Dr. Throne, that are amazing resources that can help you, but just don't give up.
That's for sure. You have that mom gut for a reason. And so often I see moms sitting here, they're emotional, they're in pain, both from giving birth, but also from trying to nurse. They feel like a failure, or they've been told that you just can't nurse, or
Yes.
you're malformed, or my milk never came in, or something like that. And that's just, to me, I call that mom shaming. That's kind of and sometimes we do that to ourselves the worst. And, you know, it can come from other providers that aren't fully educated. It can come from our own selves, or it can come from spouse or in-laws or parents. You know, you just never know, or even friends. And so don't try not to take that personally, and just understand that that's their journey and their place, and don't second guess yourself, because you do have a very maternal instinct and a sixth or seventh sense where that's concerned. And if something's not going well, don't hesitate to reach out. That in no way means that you have failed, in any sense of the word. It would be no different than if your child's fingers, when they handed them to you, had webbing there. I mean, that's no different. You wouldn't just ignore that. You know, you would ask questions about that. So don't feel like it's your fault, or that you can't ask questions. And we'll talk about some questions here towards the end of the presentation that, you know, because you asked and thought it got taken care of. And I hear that word clipped and it makes me cringe. But because this is so much more than that. And, you know, if you haven't been trained and learned the processes of surgical release for these tissues to get them fully released, and you don't understand that it's not just diagnosed based on a photograph, it is a functional diagnosis. I didn't just take these two pictures of Bowen without my fingers in there. I'm actually engaging and lifting and putting those tissues into function. And that's when those tissues present the restriction. So it's not anything that's diagnosed based on a photograph. It is a functional diagnosis, and the child or adult has to be checked with the tissues in function and functioning, because they don't always show themselves. So it's truly a functional diagnosis. So you wanted me to talk about the differences of, we hear these terms tossed around a little bit, and frenotomy versus frenectomy, what that means. Is there a difference? Which there is. And then a surgical philosophic approach, and does the tool used matter? So let's chat about that for a second. Frenotomy means to cut the tissue, but you do not remove any of it. So that would be indicative of a scissor procedure, probably what you had done in the hospital, where they just clipped. They went in with scissors and just clipped. did not remove anything, versus the frenectomy is where they could have gone in with scissors, grabbed hold of some of the tissue and cut it loose and taken it out. Then that's a frenectomy. But frenectomy is also done with a laser, whether it is a cauterizing device like a diode hot laser where it's vaporizing and removing tissue, or a CO2 laser. Those are all frenectomies. It's removing tissue. And so another important factor with that is the approach that you're using, whether it's the clip or if you're actually putting that tissue into function during the surgery and checking repeatedly, release, lift, that matters. So the surgical approach does matter. And that's kind of a functional frenectomy is what I call that. That's a term that Dr. Zoggy, one of the pioneers in this field, kind of coined when he developed actually using a functional approach to this. I took that course years ago. I apply that philosophy to every single frenectomy, whether it's the tongue, the lip, the buccals, it does not matter. Everything, every single one of these tissues is in function. Whether we smile, that engages the buccals, speaking, swallowing, there's all sorts of functions that these tissues have to support. And if something's restricted, you've got to see that during the surgery to get a full release. So we hit on the tools a little bit. The tools don't matter as much if you have the philosophy and the surgical approach to get a full release. Where it does matter the most, though, is in pain control and hemostasis or bleeding. Obviously, the mouth, any mom knows any kind of bump to the mouth and there's blood everywhere. So using scissors, something like that, that's going to bleed and bleed quite a lot. So that also creates more inflammation deeper into the tissues, which increases pain for children. A lot of even infants, older children, and adults, if they have the surgical procedure done with scissors, they oftentimes will suture, which brings even more pain and more trauma to the area. So the tools do matter a little bit. Obviously, with a cauterizing device, that's going to create a little bit more inflammation than some of the very superficial cold lasers, CO2 lasers, things like that. So hopefully that clears that up. Do you have anything to add on that, Casey, that you can think of?
Yeah. So when you did Bowen's, maybe talk a little bit about, we did the lasering that you're talking about. And then people often ask me, what does that look like recovery wise? What are you having to do at home? Because I know we had things that we had to do at home. And so maybe just talk us through a little bit about that process and how that works.
Okay, well, so much of this is controversial to begin with, but it shouldn't be. Any tissues that lay down on themselves, any wounds like this that lay down on themselves, that is going to reattach. That's basic wound healing 101. And whether it's the lip, the cheeks, the tongue, all of those are laying down on themselves. And so to think that you don't need to stretch or work that area is somewhat of a misnomer. Now, if you go in and suture that's possibly a different story. But for laser, in my office, my protocol involves a month of every 4 hours coming in and stretching. And we go through that. There's videos on my website to see what that looks like. But it's, I always say it's the longest 15 to 20 seconds of your life, but it is over fast. And you tell yourself the whole time that you're doing this for them, not to them. Just like changing their diaper, they fuss and cry when you change their diaper sometimes because they don't want to be messed with. And normally we do these, it is very quick, it's over. You don't have to hold it for a 10 count each time or anything like that. They're very quick. It does matter. You want to get a good depth to it and focus on right at the fold, making sure that, because that's where it's going to attach first, and getting a good stretch there. But we demonstrate all of that. Like I said, there's some resources on the website too. I try to empower parents so that they don't have to go look elsewhere. and turn to mom groups or what have you, and be asking questions that they should be asking me. So I hope my goal is for parents to leave pretty informed and not have a lot of questions about that, and or other patients at other ages. You never want to do any of the stretching more often than 4 hours, in my opinion, because especially on infants, you can create some oral aversions, and at a time where you're trying to get them to nurse and such. So 4 hours is kind of the sweet spot that we have found, and studies are showing that are coming out that shows exactly the best wound healing, how you can go the longest as you possibly can before it starts to reattach. So does that answer?
Yes, and I will add very much so. I mean, you were always available for us if I had questions, and you
can't operate on babies and not be available. Can't operate on anyone and not make yourself available after a surgery.
Yeah. But even, people hear, oh, every 4 hours, like what in the world? I'm going to have to wake him up in the night. And honestly, because we caught it more early on, I mean, one, he's never going to remember it, but two, even in the night when I would go in and do it, half the time he stayed asleep. He would just, he didn't even know and he'd just go right back to sleep. So, it is a process, but it's worth it. It's worth it. And in the big picture, it's such a short season that it
doesn't feel like it, does it, when you're going through it?
But as
you look back, it's just a blip on the radar. Yeah.
Yes, for sure. What's the saying? The days are long, but the years are short.
Right. Exactly. Yeah. Exactly. Mm-hmm. Exactly. Here's some photos of the tethering. Notice again, these aren't just pictures. They are photos with my fingers in there lifting. This is a functional diagnosis. And so we are putting these tissues into function and seeing, yes, they're restricted. No, they're not restricted. And looking at it from that standpoint. And I do this in the room with the parent.
And like Bowen, when with his buckles, he was actually had more than one buckle on each side. So it's not necessarily just the one connection. There can be multiple.
That's correct. Yes. Or even across the front, across here, even not just the center. They can be restrictive quite a few places and putting tension. So I thought we'd talk and look kind of at some of the symptoms that go along with tethering. Now we're focusing a little bit on babies here at first, but we'll get into some other age groups here in just a moment. Milk tongue, I see this on almost every one of my babies. This is often mistaken for thrush. This is pretty much just where the tongue is not touching the palate to cleanse it. If the palate is here, this tongue is only able to do that. And you can see that right where it's clean.
Yep.
The tongue is able to get up there to the palate, touch it, and the milk is swept off. Everywhere that it can't touch is left with milk on there, and it builds up over time. Not everybody is this severe, obviously, especially there on the left, but it's somewhat of a rudimentary tongue function study, because you can literally see when they do have this type of presentation, you can literally see where the tongue is touching and where it isn't, and that's where all the restrictions on the left, especially, is very restricted tongue are able to reach the palate there. So here's a couple of slides here, photos with nursing blisters. You can have a central blister, large like this right here, but this child also has blistering all the way around. That's circumferential blistering, kind of like this too. This baby came in like this, and when I saw them a week later after release, this coloration was gone completely. All that blistering had healed. Yeah. Definitely had healed. A lot of times lactation medical personnel will say, if you see this, they'll just say, oh no, that's normal. Well, that's a huge blister and this is blistering all around. How normal would it be if you or I had a blister on our lip, plus we're trying to feed. This happens from friction when there's restrictions and the flaring, the proper flaring up onto the breast of the lips can't happen. They end up catching the lips, and the friction rubs these blisters, and that has to just be miserable. Poor babies, poor babies.
Yes.
So,
and their lips should flare.
Should flare.
And Bowen's never, they were always just straight on. Because he was restricted, it was just literally like he was sucking like this, where their tongue should be waving and their lips should be flared. And no matter,
his cheeks were having to do all the work, and his jaw biting you too. No wonder you were sore. With all of that going on, he was compensating, what we call compensating, trying to figure that out.
You'll hear too, you will hear that clicking noise. That should not be happening. And I had no idea. I just thought, oh, well, it's just normal. But that every time that the clicking happens, the suction is breaking and they are sucking in air every time. And that's just pumping more and more air on their little tummies. Hence the gas, the reflux, the screaming for hours, often mistaken for colic. And they have gas because they're sucking it in every time.
Thought we'd talk a little bit about breastfeeding, things that we do know, that we already know. Most of us breastfeeding goals for nutrition and immunity and bonding mother and child, but some things you don't know that they don't tell you, and that's breastfeeding's role. The actual pressure of the breast and the tongue on the palate actually helps to shape the cranial bones, the airway, dental growth and development of the face, the skeletal system of the head. That's all very important. And the act of breastfeeding actually helps that, as opposed to what you were just saying, bringing in all the cheeks. That's all compensation. And that brings in other types of forces that we don't want on the face, the narrowing and lengthening of the face, the high vaulting of the palate. The very few OB-GYNs, pediatricians, most doctors don't talk about moms and breastfeeding and the benefits of breastfeeding to mom. Studies show greatly lower rates of cancer later in life for moms who have breastfed for 6 months, a minimum of 6 months. And those include breast, ovarian, uterine. I could keep going, but I feel like moms deserve to know this, because if you're trying to make, in addition to a birth plan, you're trying to set your goals for what your breastfeeding relationship wants to look like, how long you're going to try. I think that's important to know as a mom. Hey, if my chances of breast cancer are greatly reduced if I can breastfeed for 6 months, and I don't mean exclusively, if you just do what you can and continue to breastfeed as much as you can, that could have huge health benefits for mom. Definitely take that into your heart and educate your friends about that, because that's a critical point that not very many people know about at all. Were you told of that point, Casey?
Nope, I was never told of that. No,
I don't know that I've ever run across a mom, maybe one time in all of the moms that I've seen were aware of that fact. We know that it helps to reduce postpartum depression through oxytocin release and some of the other feel-good hormones in the brain. And then the last little tidbit I put in there was that the World Health Organization actually right now recommends 2 years of breastfeeding for as often as possible. I'm not unrealistic. I work full-time. There's no mom that can be the pacifier and the feeder 24/7. But if you can continue to breastfeed off and on when you can, for as long as you can, that has great benefits to your child, obviously through the airway development and the dental bones that house the teeth later in life. It may not prevent orthodontics, but it sure can help with some of these issues with the growth and development of the facial bones and the cranial bones. So speaking of cranial bones, let's look at Mr. Bowen again here, and I'll let you talk a little bit about this slide that you asked me to put in.
Yeah. So after visiting with you and getting our release, and really starting to understand how everything, with the anatomy is connected, because I feel like that was something that was one of the more fascinating things is how all of this is connected everywhere. And once we started connecting the dots, it was like, okay, well, this makes sense on why he would only look to one side, why he would only sleep to one side. All three of my children have flat heads in the exact same spot. They were all on the same side. Landry's thankfully kind of worked itself out. I feel like, almost 10 years ago, the helmet was a pretty new, not very heard of thing. Britain comes along. Hers is still misshaped. We did nothing with that. And, thankfully at this point for her hair covers it. She's 4.5. But so with Bowen, at that point, we were directed by our pediatrician that Bowen's head was completely misshapen and he was going to need a helmet. And so we went down that route of having to, a year long of having the helmet, going to cranial therapy. And you'll see now more and more today how common helmets are. And in our situation, this helmet 100% was due to all of his mouth issues. Had he been released correctly from the very get-go, I truly believe like this wouldn't have even been an issue. But you'll see in his pictures there to the left, the left side is the start, where he started. And then the pictures on the right are where we ended almost a year later. And now even knowing, and you can talk about this too, just the body work that you do within your practice. I would have loved to have gone that route versus the helmet. At that time, I didn't know any different. We had not reached out to Dr. Throne after that. We went with what our pediatrician had told us. And not to say that she didn't know what she was talking about, whatever, but one of those issues that I wish I would have educated myself a little bit more on to know what my options were. And you can kind of explain, with the helmet process, how that's not really fixing the issue, kind of what we talked about the other day. It's kind of that quick fix, but it's not.
Yes, it may not hold long term. The tongue pressure, putting pressure on the palate and on the sphenoid bone, which is a winged bone that sits right behind the nose here, kind of deep in the skull. All the cranial bones have to fit together like puzzle pieces perfectly. And when one is off, or there's tension on it, or multiple tensions, everything has to adjust. And it's kind of a whole entire fallout. And so what we try to do as a team, and I'm such a small piece of all of this puzzle, what we try to do as a team, the body worker team, we try to release the tension. What we do we always start before, work a little bit on the body, then do the release, and then really focus on the work afterwards. And something like this can really be taken care of with a good body work team of craniosacral therapists, myofascial massage therapists, chiropractors, osteopaths. All of them are very, very well versed if they are on a tethered oral tissue team, centric team like this, talking back and forth, studying together. These types of issues can be managed without the helmet. Sometimes they put that helmet on and they force those bones into that position and hold it just long enough till the child's hair grows. And then you may not realize that once the helmet comes off, things start to kind of revert back, especially if the tensions and the tongue position and posture is not addressed. It can revert back either to the same shape or to something a little bit different. We don't have much control over how those bones move when they're under pressure and tension, and when they're under aberrant function, if we're not functioning properly with the tongue up and not down. So all those compensations can play a huge role in the cranial shape and things like that. Anything else you want to say on that? I wish I had been able to help you with this, and it broke my heart.
I wish that I would have reached out to you on that.
Your medical insurance didn't want to cover this either, to correct this, because this in no way, shape, or form, and hear me, everyone out there, this in no way, shape, or form has anything to do with cosmetics.
Right.
If we were talking cosmetics or aesthetics, that would be probably 8th or 10th on the list here. This is growth and development, fluid flow of the cranial fluid, cerebrospinal fluid. Those bones have to all be able to pump and flush the cerebrospinal fluid. This is not a cosmetic problem. Right. Yes, it's not aesthetic, but that is low down on our list. But insurance isn't gonna, they're gonna pay for only what they have to pay for. So
that's right. Yeah.
Providers should advocate for you and help with that, or your state insurance commission, like we talked about yesterday. We make a big focus trying to help moms and try to get moms as healthy as they can, and empower them before they get pregnant is really our target. As we kind of move and transition into older age group here, from just babies, finishing up some of the pregnancy part here, getting moms in the best place that they can be before they get pregnant, whether that's breathing, sleep quality, vitamin D3. I know that's kind of everybody's buzzword right now is D3, but it is real, guys. It is a hormone. It's precursor to so many things and drives so many processes in the body. It is so critical. And if mom is low in D3 before she gets pregnant and then stays low in D3, or she's not breathing well, think about our babies developing in utero when mom isn't breathing well. Who's supplying the oxygen to both people? And so these or isn't sleeping well. These things matter. And the vitamin D3 deficient mom is going to pass that straight on to a vitamin D3 deficient infant. And there's so many things that are critical for vitamin D3: gut health, weight, brain health and chemistry. I alluded to that. D3 precursor to a lot of our neurotransmitters in the brain that can affect postpartum depression, things like that. And these things being passed to our babies, we've got to pay attention to those and try to get moms. Be more focused on moms before pregnancy, before you get pregnant. Take care of yourself. You matter. Believe it or not, you matter. Hear me, you matter. You matter. And so it's super important to get you in a good place before getting pregnant. There's a lot of resources that are available to you. My friend Krisha here, let us have this picture where she runs a program. She's probably not pregnant in this picture, but she runs a program for training for 10 centimeters, where you through yoga, stretching, exercise, you get your body ready to give birth. I mean, what a fabulous idea. And so many people don't know that there's resources like that out there for you. Yeah, whether it's before you get pregnant or once you do. So our next one, since we're talking about the body, here's kind of what you were alluding to, as things are connected. This is the deep front fascial plane. You can see here that the tongue is at the top of this, and this fascial plane runs through the mediastinum to the diaphragm, comes down through your torso all the way, splits at the legs, and runs all the way to the feet. So it's not uncommon for adults, especially, when I'm working up here doing one of these releases, for them to feel tingling in their feet, sometimes their hands. They'll feel a release on a shoulder. They may feel something throughout the chest here, maybe up through here, not with the tongue on this one, obviously, but they can feel a release in their cheeks at the sinus level. They'll open up, a release will open up their sinuses, and I feel and sense them react. And I'm like, whoa, what just happened? Tell me what you feel. And I'm like, I just can, my right side of my nose just opened up like I've never been able to breathe before. And we stop. I said, well, let's just take a second to appreciate that and kind of acknowledge it and celebrate that for a second before I do the other side.
Yeah.
So, and you know, sometimes it's not both sides, but it's so interesting how every single body is different.
Yeah.
All our compensations are different. Any of these therapies that we do getting ready pre and post-op, they're very customized to your particular function. This is all function driven and functionally assessed by specialists trained in their individual professions. So if you're wondering about what I mean by fascia, you can see that that's the sheathing between and around muscles, organs, skin, joints. It's the kind of clear, gristly stuff that you see when you separate a steak or chicken. There's stuff all around that. That's kind of the fascia. Connects and reinforces. For some people, it's massive. For me, when I had my procedure done, Dr. Kundell released here and it all rolled into my cheeks. I was huge like this, and it was immediate. It was all fascia, not swelling. Swelling takes time to develop, and it gets better over time. We eliminated this for me in a lunch visit to a body worker, a fascial specialist, myofascial specialist, released all of that fascia. I came back, my face was flat, no swelling or puffiness. So it can be extreme. Not everybody has that response, obviously, but leave it to me. And we were in New York City. So go figure, walked around New York City like that because I didn't have the body work.
You had some major Botox going on.
Oh, it was hideous. It was huge, huge. These fascial restrictions right under the skin especially can feel almost like a straitjacket. And that's kind of what we see with these infants I was talking about a minute ago. Once they feel that release, it's almost like a wave through their whole body, just kind of releases and relaxes. They're walking around kind of in a straitjacket that's several sizes too small, pulling on either organs or bone, what have you. So in keeping with that, here's obviously, these photos are all shared with permission. A lot of these are on my website, which we'll look at here in a second if we have time. But here's some postural changes with a tongue tie release. Not everybody has this extreme, but this one was pretty extreme. His pre-op photos before I set him down for the surgery are on the left. And then when we stood him up, that's the right side, both upper and lower. So this is before, this is after. Yeah, and you want to look at things like, if you're not sure what you're seeing here, but you can tell there's some difference. Let me point a few things out. Look at his forward head posture here. So he's walking through life with his head up like this, trying to breathe, and he can't walk like that and see. So his forward head puts a tremendous amount of stress right up here on the upper back, lower part of the neck. He was miserable in life, headaches. He did not feel good. Scoliosis diagnosis. A lot of these patients, because of the tensions, they have some twisting of the spine like that. His was pretty severe. You can see the shoulder differences here, along with the scapular winging and the uneven scapulas. And then just the difference. And this was this literally right as we started the surgery, right as he got up from the surgery. So there's not even any body work that happened here. This is all just release. Now there was body work before, and his body got ready for this. So his body, once it's ready, we can see some pretty dramatic results like this. And then you go back and have some continued body work. So it's so critical and important to have body work before and after. And that's sometimes a missing piece of the puzzle. That's kind of the point we're making here with this slide. It's important whether it's an infant or it's an adult or anywhere in between. The fascia, the tongue, the toes, the arms and hands, the back of the head, neck and face. We see lots of patients feel release through their back of their neck, the occiput area, through their head, their shoulders, their upper back. They routinely tell me they feel like if it's an adult especially, they tell me they feel like they've had a massage, but I don't touch any of that really, other than just to feel when I'm feeling for tension. I'm not rubbing on them or anything like that, unless I feel like sometimes I'll work right here if I need to, if I don't have a body worker right there with me. If I see the fascial response looking more like what I did. So I try not to leave people like that. But the tongue is so critical for balance and posture too. We don't appreciate that, but your bite, your occlusion, how your teeth fit together, and then the tongue being up in the palate helps to stabilize the entire body, head to toe. And when you can't get the tongue up there, there's all sorts of compensations that your body has to come up with to help support itself or reinforce itself. So one of the most extreme things is breathing. The release of the soft tissue that's attached to the diaphragm can make a huge difference in the ability that you have to take a deep breath. I didn't even realize. I remember in dental school not being able, when we studied about lung volume and capacity, total lung volume, those things, I couldn't, and I'm competitive, of course, and so I couldn't compete, and it really made me frustrated. And it took about 3 weeks, breathing, retraining, really working through some of the specialists that we have on the team that work with breathing and realignment and tongue position, to where all of a sudden I began to feel a release through that lower part of my diaphragm on both sides. And I could take a deep breath and feel air moving in areas where I had never felt it before. And for some of us that matters, or it doesn't matter. If you're a pro athlete, that's going to matter a lot. If you're a singer or a musician, that may play a critical role and make a difference in your whole world, So that's really an important aspect when the tongue is attached to the diaphragm. And if it's too caught and it's pulling, imagine how that must feel. And that's your normal. You don't even realize it. So moving on to some of the other symptoms I kind of hinted a second ago, we see a lot of migraine and TMD, neck and body pain that's associated with all these compensations when you're not able to have the tongue up or functioning and have it supporting the body and the spine like it's supposed to. Other parts of the body have to pick up the slack, or if our head stays forward like this, the head weighs anywhere from 10 to 15 pounds or more. That's a lot of tension on the upper spine, rather than loading it in more or less a long axis like it's meant to. If it's forward like this, and then you get the dowager's hump, you can have such a variety of symptoms through TMJ, migraine, headache, ringing in the ears, as more and more inflammation comes in. So obviously, if your tongue isn't up where it's supposed to be, shaping your palate, you can be lagging on your skeletal growth for the jaws of the face and the oral cavity. That leads to crowding of teeth, but it also leads to airway collapse and struggling to breathe, which you see here. This is a picture of a poor gentleman who really we're not asking him to say ah or anything. He is just opening his mouth and letting me see back there. And he literally, on his best day, he has, I wouldn't say that's a coffee stir, but it almost is. And all of this redundant pharyngeal tissue that's not supported by the skeletal parts that are supposed to hold that tissue up out of the airway. He not only has just it falling into the airway, it's circumferential collapse, where he's so narrow and short that he's affected in both dimensions, both the AP and the horizontal dimension. And it's just resulted in huge amount of soft tissue in the back of the throat that he's struggling to function and breathe through. So we try to get these people breathing through their nose, but years of this and fallout from this, it's really, really rough. To help with correcting some of this, we try to get it early. I can do some early intervention, minor orthodontics, and as young as about 8 months old. And if I get them early enough, there's some things that we can do with the parents. I know that blows up in the traditional orthodontic world of early intervention, they more or less look at 6 and 8 and 10, that range is early intervention, where we're trying to get these kids in early toddler and get them in some devices and get them in some myofunctional therapy, try to correct these compensations, release any tensions if they've got them, and try to correct function and begin to expand the actual bones and the airway. The traditional expansion, if you've talked about traditional ortho expansion, you'd have a band here and a band here, let's say, and a pretty good sized bar across here that you would turn a key. Mm-hmm. And that is moving some bone if you get them early enough, but it's only in one dimension, and we're somewhat limited on what we can do with that. These appliances in different age groups, these go beyond that, and they do it in 3 dimensions. So there's a lot of different devices and schools of thought on that. So there's some information on my website about that if you want more information on that. A lot of times we come in and we can make positive improvements in people's lives and in their airways, their breathing, all the way into the 6th decade of life. When I look at a patient, whether it's an 8-month-old or an 80-year-old, I'm thinking airway first, straighten teeth later. Yeah. If we even straighten teeth. The main focus is breathing, airway, because straight teeth, yeah, that's important. It helps to fight off decay. It's important for our self-esteem, but breathing is critical to life and critical to so many other processes in life. And we can really start to see some pretty big comorbidities and fallout with that you saw on that list when we first started. So one of those that you wanted me to talk about a little bit and touch on, because there's so little information on that out there right now, and that is ADHD and its connections to breathing. So if you're interested in this study, you can screenshot this slide here. But this is a study that was done years ago, so I don't know why more people aren't aware of it, but this study was done by Dr. Bonnick. This is called the Avon study. You could probably Google that and be led to this, especially if you put Avon, like the cosmetic company Avon, and put ADHD, and Dr. Bonnick, her name is spelled there. You can pull this and look at this study yourself, but this was an incredibly large study. The number, I believe I have it on here, ended up being over 13,000 kiddos that they followed from the age of about 4 to 7, I believe. And all of them that were showing signs of ADHD had disordered breathing, some sort of disordered breathing that was affecting their sleep. And that is so critical, because we're in such an age of these, both ADHD and sleep apnea. If you think about those two, and that's a lot of children. Some adults are getting diagnosed with ADHD, but children, and then sleep apnea in adults. And for those to be related and stripped away back to something that's actually a breathing disorder that could have been dealt with or can still be dealt with, if it's identified and we actually go for the core problem, the root cause of what is the problem. Dr. Temple the other day, she said that we're so stuck in medicine, and she's of course a medical doctor. She says we're applying acute care medicine to chronic conditions, and that simply does not work. There's no root cause diagnosis or treatment. We're just treating things superficially, like they're all in their own little bubble, instead of looking, wait a minute, could all of these little things, my hypertension, my stroke, my sleep apnea, my diabetes, my ADHD, anxiety, depression, my reflux, could all that actually be in one big bubble? Whoa, who would have thought, right? And so this type of a study really makes a difference to a lot of parents. If you're looking for an alternative to just a pill, to put your child on a pill, I would say start here. A good sleep study that's read by a sleep center or a sleep doctor that is familiar with the current standard of how to read sleep studies, that's not just looking at the apnea hypopnea index, AHI. If they're looking at sleep breathing disturbances that are smaller than that, because a lot of our children and adults, they don't stop breathing enough times to even have that be caught on the radar of a sleep study if they're not looking fully at it. And that's kind of some new within the last 4 or 5 years, new way that the American Academy of Sleep Medicine has suggested that we read these sleep studies. But for the most part, the sleep centers have not switched over, and this is not on the radar for most physicians. They just order the sleep study. They tell you, no, your child only stopped breathing 4 times an hour, so or 2 times an hour. So I think they're okay. They're 13 years old, so they're probably okay. We can't sell them a CPAP, so let's keep an eye on them. And that's just, I don't want my child to die or stop breathing. I want to catch it earlier if there's flow limitations, gas breaths, if their heart rate is spiking continuously. Children and even adults should have heart rates in the 50s to 70s when they're asleep. If your heart rate is over 100, your heart is in essence exercising all night long, waking you up because and you think you're waking up at the same time every night thinking that you have to go to the bathroom, and that's actually your heart. I mean, that's scary. And we see children wetting the bed, not just 4-year-olds, all the way up until 12 or 13 years old. These are all big signs that something is going on with the breathing that is interfering with sleep. So when I say sleep study, what I really call it is a breathing study during sleep. Yes, it gives us some information about the sleep and how much deep sleep we get, but really we're looking at breathing. When we take some of these home tests, the majority of what we're looking at is breathing during sleep. We're looking for flow limitations. We're looking for heart rate spikes. We're looking for the blood oxygen levels, things like that, the effort that it's taking to breathe. If you quit breathing, it'll pick that up too. So yeah, it matters how these studies are read. So you have to kind of keep that in mind when you go ask for these studies. It's really critical that you be sure they're being read up to the current standard to catch these types of things. So I would encourage parents to find out about this, print this article off. If you have a school nurse that's suggesting you go get checked for ADHD, or a psychologist, or you're going to go meet with your pediatrician, bring this study. I bet you a lot of them have never heard of this, and they'll be at least open, because you're coming prepared. They may be at least open to listening to what you have to say. And you're ultimately in charge. You get to be the one that makes the decisions. Healthcare should not be done to you. It should be you're an active member in this and making decisions and what's right for your family. So
100%.
If you're looking for providers for this, I always get this question online. 2 questions to gauge provider knowledge of tethered oral tissues. If you're out there looking for a provider and you're not sure they know what they're talking about, these are 2 simple questions that you can ask them. And if they cannot answer these 2 questions, they more than likely have not put the work in to be doing the procedure. All righty. So the first question is describing the classification and how the tethered oral tissues are classified. What determines each classification? And that goes for lip and tongue. The buccals don't have classifications, but lip and tongue, if they can't tell you what the classifications are, more than likely they don't know, what necessarily have a great opinion on what they're seeing. The other thing, the other question is to name a couple of TOTS pioneers that have done a lot of research in this area. And if they can't list you 2 or 3 names, in addition to telling you about the classifications, I would suggest very strongly that you get another opinion. Going hand in hand with that is the position of the provider when they do the exam. If your lactation consultant is standing beside your bed and just looks across the bed and looks at your baby and says, nope, I don't see a tongue tie, they've not checked function, have they? This is a functional diagnosis. And so whether it's an adult, a child, or an infant, it needs to be a functional diagnosis, and that is critical. So position matters of how you check these two, especially in infants. In infants, we have to bring the tissues into function for infants, and so the position of the provider really matters there. All righty. I thought of one thing I skipped that I think we should go back up to right here and make mention of on the ADHD slide here. There is a YouTube video called Finding Connor Deegan. If you guys want to, I try to have everybody watch that that is facing an ADHD situation or an overactive child. If you're starting to struggle, even if you've not been diagnosed yet. Finding Connor Deegan on the YouTube video. I also have that on my website. That's a powerful video that was put together by a mother and also the Foundation for Airway Health. And we'll talk about that here in just a second, but for some resources for you. But that kind of concludes what I was going to give you today and talk about. There's tons more we could touch on maybe another time, but I sure appreciate you having me and giving me the opportunity to talk and share some of this and empower some families with some good information. So alternative thoughts.
Yes, and I'm so appreciative that you would give your time and you guys the research and the knowledge and the time that she's taken to put this together for you guys. I'm honored that you would come on here because I truly believe knowing this information can bless and free a lot of people. I know it did for us, and just a really dark time in our life when we just felt like we were desperate. We didn't know what to do. And so that was our goal with this, is we want to bring awareness to this. And, for those that are local to me, she is just in Fort Worth. And so I cannot recommend her enough. But for those that aren't in the Dallas, Fort Worth, North Texas area, or not even maybe in the state, where could someone go to find somebody to do what you do?
Well, I would say to start with maybe the Foundation for Airway Health or the Breathe Institute. If I minimize this real quick and we take a peek here at my website, if you go under the more drop down menu there and under, let's see if it'll let me do it around my picture here. I struggle with that a little bit. As soon as I move off of it. Well, it's under the links right there. And Foundation for Airway Health, also the Breathe Institute has a list of providers. The IAOM, that's one of the mild functional therapy organizations, one of the large, very well organized ones. There's a lot of those links right there found on my page under that links. Right under that more. Also the recommended reading. I have a recommended reading list there that I just put together on Amazon. You click on that, it takes you to your Amazon account, but my list, I've got a couple of books. We have a large library here. I love my parents and patients being informed. And if I don't know something, you make me better, because then we go learn it together. And so you have to have informed consent. You have to have information in order to pick the solutions that are right for you. I'm not here to provide the solution other than I'll do the care once you make up your mind. I'm here to answer questions and help you get there in making up your mind what's right for you. And then we move forward. But making your mind up, that's your job, and whatever I can do to help empower you for that, to find that. 2 books, great books, GASP. If you're curious about airway and its role, the GASP book, and that is found right there on my links, okay? And these are the founding members of the Foundation for Airway Health. And then Dirty Genes, it's a great book too. talks a lot about some really relevant issues right now, but everything on that recommended reading list is pretty informative for no matter what you're finding that you're dealing with right now. So
Yeah.
there's other information under the services menu. You can see a lot of this information here. That Finding Connor Deegan video, if I can get that to open, is down at the bottom of this services page.
Mm-hmm.
Doesn't look like it's going to load right, but here we go. Right at the bottom here, there's the link to the Finding Connor Deegan. So all sorts of good information on the page. If you've got further questions, I would point you to the page. I can't really answer a lot of questions or provide you medical advice, of course. That's a little bit out of the scope across a teletherapy or a texting or what have you, but there's a lot of good resources out there, and several of them, going through the links. Even the Foundation for Airway Health, I think, now has a provider list if you're wanting to find growth-centric airway supportive dentistry in your area.
Yeah, so definitely check her website out, because all the stuff that she has on there is free. I mean, she has so many great resources and articles and all the things. So it's there for you to help empower you. But two, I just want to mention, in no way ever would I ever bring this to you to be condemning or to, if light bulbs are going off right now and you're going, oh my word, like we should have done this, or, you start playing that game and you go down this spiral of what have I done or what have I not done? Just know that is not my intention. That's not Dr. Throne's intention. Our heart,
not at all.
That we want to provide you information. I want to be able to be a help to you also. I know I've lived it. I still am going to be living it. Like I've said, my 4.5-year-old and my 9.5-year-old both still need to be released. So this is an ongoing thing for me too. And so I'm happy to answer any questions on my end as to, how it works, what the emotional side of things. I'm an open book and am willing to help in any way that I can. Obviously, I'm no way a doctor, but I just want to share this with y'all so that you don't feel alone, and that you just have another resource in your arsenal to be able to continue to educate yourself. Because I truly believe, I feel like the older that I get, the more kids that I have, the more I see how important it is to educate yourself, to reach out to people for help. Like Dr. Throne said in the beginning, just because you reach out for help does not mean that you're weak. It doesn't mean that you're a failure. We're created for community, and you're not meant to go at this alone. And so anyways, my heart just goes out to you mamas who may be struggling with this, may not have known anything, but maybe this information is, the light bulb is going off and the dots are starting to connect. And so, anyways.
It's like Amanda said earlier in your week, interviewing with Amanda, her business is the Mama Cabinet, the little tidbits that you take. And this is how my approach is too, is the courses I go to, each parent, each procedure that I do, I get these little pearls is what I call it. And I just keep them on my necklace, and I see them there. Sometimes I forget one's in the back, but it'll come present itself again. Anything that you hear or see, you just put in your cabinet or on your necklace and try to do the best that you can. Do not shame yourself. This was not meant to be critical of physicians, orthodontists, no one. None of us got this information. You cannot know everything. It's so humbling to be navigating the medical world and to stay up on top of everything. You just can't, and you can't know everything. And it takes a real spirit to admit that and to understand that, but then you have a responsibility to go find it, to go find out and to educate yourself. And if parents are coming in and you feel like they know more than you, that's a problem. You got to go get educated on that. And so whether you agree with it or not, at least be educated so that you can answer their questions and steer them back to what you feel is right. So anyhow.
And definitely, don't give up. If you feel strongly about something, I mean, you guys know, like, if you feel strongly about it and you feel like that's what the Lord has called you to do, then by golly, you just keep going. Don't give up. And I mean, I 100% believe that He has given us that mama instinct. And so if you just keep going, don't give up, keep searching, keep asking. And I really do feel like that it'll pay off. I mean, and you know what? And even if, I look back on my life now, even with my children, and there are things that I wish, and I know many of you do, that I wish that I would have done different, with my first, with my second, and even my third. You never get to a point where you have it all figured out. But, I can look back on that and go, oh man, I wish I shoulda, coulda, woulda. But again, you just add that nugget, and maybe that is allowing you to be able to help provide information for somebody else down the line, regardless if you
just exactly like what you're doing with this, just exactly like what you're doing with this. It truly is a calling. And even though you might not be able to apply it in your life with your children or what have you right now, becoming an advocate for some of these issues and helping other moms so that they quit shaming themselves and they get some help for their kiddos, like what you're doing. I applaud you, Casey, for creating your own platform to make a difference with this as your ministry and calling. So
I appreciate you saying that. That's sweet. And I truly, the day that I messaged you, I thought I would be shocked if she messaged me back, but I'm just going to throw it out there. And I about fell over when she messaged me, said, oh, I'd be honored. I told Scott, I'm like, oh my gosh, I'm going to cry. She's going to do it. We're going to get to hear our story.
Oh, so I didn't even have to think about it for a second. I'm looking for these opportunities because I want to help, empower moms, not to, and get them off of this mom shaming and this roller coaster of no answers. So, yeah. And some alternative. I mean, these things are pretty controversial that we're talking about, and alternative types of medicine that's actually looking at root cause, and that's not always met with hugs and kisses when you start going into regular medicine and talking about that, just like Dr. Temple was saying the other day. So
I think all the more reason that we need to talk about it, because people don't know, and it's helping so many. And so I love it. This is incredible information. You guys, you got her website here. I'm actually going to post it too in the comments of this live. So we'll have, all her information in the comments. Y'all go like her. She has her business, or Melanie Throne, DDS PA. She has that Facebook page there. And then I'm also a part of your groups too, the North Texas Babies Tongue Tie. There's a lot of different groups that I will post in there so that you guys have the resources. She's always posting really helpful articles for different things. And it's cool too, because you can hear from other parents that will chime in, and you get to hear their story. And I mean, who knows, maybe their story relates to you more than mine. So definitely I'll have that information for you. And then she's also on Instagram too, you guys. So
I have a YouTube as well. If you're looking for some interviews or what have you, that link is right there. All those links are here. And then when you go under the services and you go to these individual pages, there are links to the support pages that you're talking about, Casey. So there's a lot of information on the website.
Good. Okay. Well, thank you so much, Dr. Throne. I enjoyed it. And
thank you. I enjoyed it as well.
yes. Well, thank y'all for joining us, and holler at us anytime if you have any questions. Y'all have a great rest of your Sunday night, and we'll talk to you later. Bye.
Nice.